What you're about to learn, I think, in this conversation is that our campus has had a profound influence on our community, on the city, and the entire state of Arizona. To acknowledge those in the room right now, all of this has happened thanks to your tremendous investment from the state, from the city of Phoenix, and from our elected officials, business leaders, healthcare affiliates, and community members. So first, I'd like to welcome all of our elected officials and community and business leaders who are with us here today. You are here to learn just how your investment is paying off, and we hope you agree by the end of today that we're on a very nice trajectory for success, not only for this College of Medicine, but for this campus and for our partners. This campus is 7 years old. We now have several hundred students training here. We have an award-winning education building that's the envy of schools across the country. We have a cancer center that's nearing completion, and we have a new research building that is underway. And with all of that activity on this campus, the one thing I was warned would be the biggest issue that I would face on a daily basis was parking. So I will apologize right now. I don't know where you parked. I hope you parked somewhere convenient. It is what it is with the construction going on. One of the main reasons this medical school was and campus were created was to address that Arizona is ranked as one of the states with the lowest number of physicians per capita. We are charged, this college is charged with producing more physicians, and we have committed to ensuring that they are the best trained doctors for this ever-changing world of healthcare. We are joined on this campus by the U of A colleges of pharmacy, public health, nursing, and now the business school, in addition to NAU's programs in physical therapy, occupational therapy, and their physician assistance programs. Arizona State University also shares this campus with their nutrition and exercise science programs, as well as joint programs that the colleges on this campus have with their nursing and social work colleges. Others on the campus include TGen, the International Genomics Consortium, and the NIDDK. In just 7 short years, we are proud of what we have been a part of and given back to our community through service, mentorship, and education. We are also very proud of our role in building a stronger economy for this region and for the state. Today, you will learn where we are and where we hope to go in this regard. We are glad you could join us. I would also like to welcome, and I will introduce each of them at the appropriate time. I'd like to welcome the University of Arizona President Ann Weaver Hart, Phoenix Mayor Greg Stanton, Senior Vice President at the University of Arizona of Health Sciences, Skip Garcia, and Paul Umbach, who prepared the economic impact report that you are about to hear. So to begin the discussion, I'd like to welcome to the podium the President of the University of Arizona, Ann Weaver Hart.
You think it's scared you should wear high heels. We're talking about the cord here by the podium. It is wonderful to see you all here this afternoon, and I am so grateful to you for taking the time out of your busy schedule in this holiday season to preview with us a retrospective on the tremendous impact that the University of Arizona and this campus have had in our great community and in our great state. It is such a pleasure for me to think back and realize that 2.5 years ago, when I joined the University of Arizona, this campus was literally only, 4.5 years in progress toward its achieving its mission. And that, in fact, as I came to appreciate more and more the tremendous heritage and impact of the University of Arizona, I truly have come to appreciate, and I hope you appreciate, that as a super land-grant university with a fantastic land-grant mission and cooperative extension program, an incredible research accomplishment as members of the Association of American Universities and recognized as one of the top 100 research universities in the entire world, as having a medical school as well, and oh, by the way, 2 medical schools completely and separately accredited and independent in their own right. And finally, with big-time sports in the United States, there are truly only a handful of universities that have all of these characteristics, with the exception that we're the only one with 2 medical schools. And it's important to me that you share with us our enthusiasm about this incredible institution and the combined impact of our mission in the state of Arizona. This campus alone, as you will learn in greater detail, has a $1.2 billion impact on our economy, and those numbers are from 2013. So you'll hear more from Paul and his team, but that incredible number represents very, very careful planning and input from all of you, and as Dean Flynn said, puts us right in the center of downtown, just a few blocks from the many, many other opportunities that are available. It has an impact in our ability to serve the community, in our ability to train the healthcare professionals that will be so critical when some of us of a certain age begin to tap into that healthcare system a little bit more than we do right now. And then through our tremendous partnerships with research and education partners around the community, and with multiple clinical partners that serve the great state of Arizona. It's a very exciting time for us. As Dean Flynn said, we broke ground, we dedicated this building in the very first fall I was here, even though the campus had been building and the entering class was just getting ready to graduate. We broke ground again in October on a 10-story, 240,000 square foot research building that we believe will create nearly 500 jobs initially, and then another 360 or so jobs on an ongoing basis, and that these are world-class, high-paying jobs, and that they contribute to our future not by paying living wages, but by building the reputation of Phoenix and Arizona as the place you come when you want to be on the cutting edge of the health sciences. And then we have leadership that is helping us to develop an incredible portfolio of research grants that multiply the impact in our economy, but also provide the kind of jobs that we know will attract people to our great city and our great state. Dean Flynn mentioned that we are nearing completion on the University of Arizona Cancer Center, a tremendous extension of our National Cancer Institute recognized research institute, so that we will have a base with our partners in Tucson and a base also with our partners here in Phoenix. And none of that would have been possible, as the dean said earlier, without the support of all of you in this room and many who were unable to join us this afternoon. So I look forward to hearing firsthand from Paul and his team of the details of the latest of our economic impact studies. And thank you all for joining us on this beautiful Phoenix afternoon that's finally cool enough that we can all leave our jackets on and walk around outside. So welcome, enjoy the rest of your time together.
Thank you, President Hart. I would now like to introduce Paul Umbach, who's the co-founder of Tripp Umbach, a firm highly regarded throughout the nation for its research, economic analysis, and strategies in a number of industries, but especially for academic medical centers. So, Paul, we look forward to hearing what you have to say. Welcome. Thank you.
Well, good afternoon to everybody. 10 years ago, it was just a vision. People had an idea. I want to really thank everybody for coming, but I also want to recognize the fact that the city of Phoenix and the University of Arizona along with a lot of other collaborators, created something that now is a national model. And usually at the 10th birthday party of an idea, we don't use words like national model. But when you see what's happened and compare it to other places, I've had a chance to work on about 100 different projects a year for the last 20 years. And I'm thinking more and more about how important and how impressive the work that's been done here in just 10 years is when you compare it to other places around the country. So I'm going to weave that into my presentation a little bit. I want to start also by thanking Denise Vandersall, our senior project director, that really pulled this whole study together, working with the folks, and Stuart and his team were such important collaborators in being able to tell this story today. I want to also thank President Hart, Skip Garcia, and others from the university. It does go back a ways, the 10-year vision. I actually did a project in 1985, 30 years ago, where I compared downtown Phoenix to other peer-sized cities. And back in 1980 or 1985, there were about 30 cities that were about the same size. Some became jumbo size like Houston. Some became super big like Phoenix. Pittsburgh, where I'm from, stayed exactly the same. We've had 2 million people since 1900. And we've had no growth in over 100 years. And we looked at these downtowns, and one of the things that was striking when I looked back at that report was how far downtown Phoenix has come in that 30-year period, and how much further it will go in the next few years. And I want to just pause and say that our 2014 study is just a thermometer going into the mouth of a child. It's a 10-year-old child that's got great, great opportunity. So I want to look at today as more of a well-baby visit or an adolescent visit than a celebration of graduation for this campus. As President Hart said, the future is really bright, and many, many new programs are going to happen. So I want to make sure I also mention the fact that although you don't see any other dates on here, I threw out 1985 because I'm old enough to do that. There's a 2025 that we're going to be presenting today that's even more exciting. There's a lot of pieces that go into an economic impact study. It's the jobs, it's the money that circulates through the economy, it's the attraction of visitors and patients. Look at us today, coming here from sometimes far and wide because of this campus. It generates state and local taxes. There's a great, great impact that this campus has on the lives of people that don't just work here and attend school here, but serve this campus. And then there's business spin-offs and the clinical activities that have grown at the hospitals. I know that I saw Peter Fine before with Banner. I know there's other representatives in the room from the other health systems. And the medical school and the academic medical center and the Phoenix Biomedical Campus is not confined just to geography. It's part of the fabric of many organizations around the region, and so it's hard to put it into a box. It's here, but it really has impact way beyond here. In fact, this next drawing, which has lots of details, really shows that academic medical centers and this campus have educational impacts, patient care impacts, research impacts, and large-scale community and social impacts. And I don't think there's another thing that we study, and we've done almost 1,000 economic impact studies since the late 1980s. I don't think there's anything that has more benefits than an academic medical center. And when you start to go and peel back all the different impacts, you realize that this slide here shows so many of the pieces. And if you think the font is small, it's only because there's so many pieces. And you have in the academic side, the University of Arizona College of Medicine, Phoenix, as President Hart mentioned. It's a separately now accredited independent medical school, part of the University of Arizona, under the Board of Regents. It has its own unique special mission. It's connected to this valley and to this community. But there's also other University of Arizona programs on the campus: management, nursing, pharmacy, public health. And you might say, why management? Why business? Well, folks, welcome to the future of academic medicine, and that is the marriage of academic medicine with business and with the economy, the marriage of engineering and medicine, the marriage of public health and medicine. So this campus is way ahead of itself in not just being a medical school only campus. And there's also ASU and Northern Arizona University, who have been campus collaborators from the very beginning. Unlike other places that I visit, and I do about 300 days on the road every year with academic medicine and universities and hospitals, typically there's the one university building, and then there's the other university building, and then there's all kinds of signage and all kinds of confusion about who is who and where is where. Here, we're all together. It's more like a beach house with a bunch of families versus a neighborhood where everybody is divided. So I feel that that is a very important way for me to look at this when you go into these buildings and you see multiple universities, plus TGen also on the campus. So when you look at the research collaborators, there are many of them. I want to mention that TGen's been part of this campus as well from the start. And then on the clinical side, I would almost say too numerous to mention the amount of partnerships that this college has and how important it is that this many folks benefit from the education and research, but also benefit the college from having all of those placements for students and for faculty and for researchers. And without this extended network of clinical partners, it would be impossible for this campus to be as successful. And then coming soon to the campus, all kinds of things. The cancer center that is pretty much almost complete. It looks like it's well on its way to being complete. And then there's growth in all the different programs, and the building of the partnership building. I call it the partnership building. I have dyslexia, so if I see a P, a B, and another letter that's like a P or B, I told Denise this morning I will never be able to say it because I'll get them mixed up. So I'm just going to call it the partnership building, which will be an amazing, amazing tribute to collaborative research and science. So you came to hear about numbers, and I spent a lot of time not talking about numbers, but I'm going to throw out some numbers. Just the University of Arizona Phoenix part of this is knocking on the door of $1 billion in direct and indirect benefit to the state of Arizona. With most of that being here in the Phoenix region. And we found out that that's like 2 Super Bowls every year happening at the same time. And although that might seem impressive to certain people, I think it so underestimates what the economic impact really is. And I know the Super Bowl is estimated at about $500 million. I'm not disputing that. But look at the Super Bowl economy in terms of lasting, sustainable jobs versus what this campus has produced in terms of the pay, the benefits. To look also beyond that, when the Super Bowl is done and it leaves, are there business spinoffs that are left? Are there research dollars from the federal government that continue to come in? When the Super Bowl's gone, does that continue to have workforce that's there treating patients, improving health, improving communities? So although that might be a nice headline, 2 Super Bowls every year, I think it really underestimates really the economic impact of the 7,100 jobs that the University of Arizona sustains in this region. And let's throw in the fact that those jobs and that economic impact also generates about $45 million in local and state taxes. And it's a really nice return on investment when you consider that it generates more than the campus itself receives. So it's sort of like a real win-win. We receive less, we give more back in what we generate in taxes. I think it's an important story. I'm going to move on to the bigger picture, and that is, okay, so now we've talked about the University of Arizona. The anchor tenant is the College of Medicine, which is the lion's share of that. But now we're going to go even bigger. We're going to go up over the trees a little bit, and we look down and we see the impact of TGen, of ASU, the impact of NAU, and then we go even higher up and we start to look at the impact within the healthcare biomedical economy. We see the impact in hospitals, we see the impact in residencies, we see the impact in physician offices, and that whole impact is about $1.3 billion and supporting over 9,000 jobs in the region and $57 million in tax revenue. I want to just say that one of the things that's important to understand is that this is every year, and this is how many jobs remain. They don't go away like when an event comes or goes, they stay. And we're seeing the bathtub, if you will, of jobs grow every year in the biomedical, health, and education sector. And while other sectors have job growth and job declines that kind of wave along with the economy, these have been solid, sustainable jobs that will continue to add. So we're adding to this impact as this campus continues to grow. When you look at the future, and this chart here below is interesting in that for the measurement that we took in 2013 has the 961 million and the 1.3 billion. The one on the left is just the University of Arizona Phoenix, and the one on the right includes the University of Arizona Phoenix plus the whole biomedical campus. And then when you look out just 10 years, you're looking at Phoenix Biomedical Campus having over $3 billion in economic impact. So there's a lot of work to be done, there's a lot of development to be done, and it comes out to somewhere around 1,000 jobs, direct and indirect, every year between now and 25, which is our projection based on the plans that we reviewed. And you might think 2025 seems like it's a long way away. I'm doing a project in a community where they've set a vision for mid-century. I have a really great community I'm working with that says we want to be the mid-century city. And somebody said, nobody can think to 2050. 2050 is so far away. So I told the community in a breakfast meeting like this, it's only as far away as 1980. 2050 is as far away now as 1980. So in 1980, downtown Phoenix started to have a vision for its future. Look at it today. What could it be another 35 years ahead of time? Well, I think this place will be so different, and this will be one of the great cities in America in the mid-century, but you need pieces like this to make that happen. The employment is a big part of the economic impact because some people can't get their head around what $1 billion is. Some people can't get their head around 2 Super Bowls or $3 billion, but they definitely can understand the fact that the job growth will be from about 9,000 to over 22,000 jobs. Now, that's not just here on the campus. I did media interviews yesterday and today, and one of the things I'm very careful on when I'm talking to the media is the fact that we're not going to shoehorn 20,000 people in 10 years into this campus. These will be jobs that are in all sectors of the economy. There'll be thousands of jobs on the campus. There's going to be thousands more jobs in hospitals and in clinical settings. There'll be thousands more jobs in biomedical industry. And then there'll be thousands of support jobs throughout the region. And they will include important jobs in tourism and in restaurants and in arts and in construction and in tourism. And I kind of go back to my 1985 study. I was younger in 85 than I am now. And I did a mapping project of downtown Phoenix, and I colored it in, and the biggest color was for surface parking, and it was mostly that color. And there was one hotel or two, I think the one I remember was the Hyatt, because it had been built by then, and it was colored in one color. If you did the same map today, oh, there wouldn't be the stadiums, there wouldn't be, you just go on the convention center, you go on and on and on. There was the Civic Center at that point. But if you start coloring it in today, think of all the jobs that are supported now, but you need something to drive those jobs, and that's why this campus is so important, because it's going to provide the sustainable income to help support all the things that are going to happen in downtown over the next several years. The whole idea of government revenue is sometimes a little tricky for people to understand. To the average person, a medical school doesn't produce any tax income. It just takes taxes in the form of tuition support or state appropriation. But everybody who works at this campus pays taxes on the income they receive. When Denise and I come to Phoenix, we're taxed from the time we get off the airplane to the time we get back on the airplane. There's hotel room tax, there's real estate tax, there's sales tax, there's personal property tax for those who own homes. There is a lot of income that's generated in the economy that then flows to local government, state government, and to the federal government. And we're not ashamed to say that this kind of economic impact will grow the government revenue sector, which is an important sector because it provides all the services. So think about it this way. If the landlord's the city of Phoenix, and the city of Phoenix is the partner on this campus, I'm really happy to say that we return tax dollars from our economic impact back to the city, back to the state, and back to the federal government. And maybe some of the federal money comes in the form of research grants, and maybe the state starts to continue and sees the importance of investing in these important projects over the next 10 years. I didn't mean to look at our state legislator right here. I was not pushing. I was looking to other state legislators in the audience. But what an important investment to make when you look at the future. And that's my next slide, the future. Why is this a national model? Well, I think it's a national model because it's just at the beginning of full flower. There's great pieces that have been built, an award-winning medical school building. I'm personally attached to these 3 historic buildings because to me, they're very special. This is the place where in planning sessions 10 years ago, we had some crazy ideas, and one of the crazy ideas was take 3 small buildings and make a medical school out of them. And I remember a lot of people in those buildings, in those meetings say, that would be the dumbest thing you could ever do. You should just knock them on down and build yourself a nice medical school building. And isn't it nice to have a great medical school building, health science building, plus these 3 gems, plus all the other things that we have, plus all the things that are coming with the Cancer Center and also with the partnership building that will be built. I want to close by mentioning 2 things. One thing I want to mention is that 10 years goes fast. One of my kids was born in 1990. He's going to be 25 years old. I really believe it was yesterday. And there's a lot of work to be done. And so I want to, first of all, thank everybody for all the hard work they've done to create this $1 billion in economic impact in the last 10 years, but also encourage you as you go forward to think about all the great things that are still ahead. And our projections are based on your history. Our projections are also based on the historical growth of other academic medical centers. And our projections are also based on what we believe is a spirit that this region has and an excitement this region has about this campus and about its future.
I'd like to introduce Mayor Stanton and share that in addition to the governor and the state legislators, the community, the city of Phoenix has been a profoundly valuable partner in this. I don't know how to state it any stronger than that. And when the vision that Paul was talking about of this campus began and continued, there was a councilman named Greg Stanton who not only saw the vision, but he championed it very strongly. And now as the mayor, he gets to enjoy the fruits of his vision and his efforts and his city's efforts. And I fully anticipate, not that I will wish his children to grow up too fast, but I fully anticipate that his children and his grandchildren will receive excellent medical care in this state, in this valley, thanks in part to what is happening with his medical school. So on that note, I'd like to introduce the mayor of Phoenix and this medical school's friend, Greg Stanton.
Well, thank you, Dr. Flynn. Now, I got to be honest with you, Paul. I may be the only one a little bit bummed out about this report. You see, I see Dave Kreider and Dave Roderick and others from the city. Do you know how much time and effort and planning and logistics and staff time we've invested in planning for this Super Bowl that's upcoming? And then we find out That we had a much better investment right in front of us, and that's an investment in the Phoenix Biomedical Campus, double annually, a Super Bowl investment. Every year. It's incredible. And so, yes, we're glad we're doing the Super Bowl, and yes, we're glad that a decade ago and ongoing, the city of Phoenix made that decision to preserve some of our best land in the heart of the city and put direct dollars from the city of Phoenix into partnership with this great university, the biomedical campus as a whole. I won't reiterate what you just heard other than it was a great investment. On the campus itself, almost 10,000 jobs, medical school and the University of Arizona related investments, over 7,000 jobs and nearly $1 billion every single year in advancement for our city and community. So I just want to say thank you as mayor. The people of my city are the great beneficiaries of this investment. And I really want to say, Dr. Hart, to you and your leadership team, and we're among friends here, right? I know sometimes it ain't easy to make those investments in Phoenix. So not everyone agrees that is a good use of, the best use of the finite research dollars. And your leadership and Dr. Garcia's leadership and Dr. Flynn's leadership to explain to everyone how smart those investments are and have the courage, because it often takes courage to make those choices. We are a very, very grateful city. I just want to say thank you, Dr. Hart, for your leadership of the university and realizing that this great university is based in Tucson, but it's a gift to this entire state and country because of the great research and economic development that's occurring. And I do want to also say a specific thank you to those members of the legislature that are here. I see our friend Representative Leila Alston. I see Representative Phil Lovas. My friend Ken Clark, who is re-entering the legislature, has been there, done that in the past. My friend from from Yuma, Charlene Fernandez, soon to be Representative-elect Fernandez. Congratulations on your huge victory, right? She was a comeback kid, if you follow politics in Arizona. I see Senator Nancy Bartow is here as well. Representative Saldate, and I'm sure I missed, good to see you, friend. I'm sure I missed others. I know that you too have choices and a finite budget. And you make the decision that an investment in this great research that's happening with this university, your investment in higher education is paying massive, massive dividends. This is what collaboration looks like at the city level in partnership with the Board of Regents. And my understanding there's a couple of members of the Board of Regents here. There they are. Thank you very much. I hope I have the list here. I'm in trouble if I don't. But our members of the Board of Regents, your leadership in supporting these investments in research in the heart of the city are very, very much appreciated. It's the city, it's the state, it's the Board of Regents, it's our private sector partners, including our incredible hospital systems that we are blessed to have here in the city of Phoenix. And I know Banner and U of A have a very special, ongoing, and even closer relationship. And I think that's going to take it to a whole new level in terms of the community impact statewide and here locally. And I could not be more excited about two of the best partners in the state coming together for the betterment of health care of this entire region. And yes, the city of Phoenix, during the worst of our economic times, and we're not out of those worst economic times, did make a direct investment in that incredible cancer center, which is under construction right now. And we're proud to be your very friendly landlord on the biomedical campus. So the list goes on and on and on. I don't want to reiterate the outstanding economic report that was just given, other than to say, as mayor of the city who's been involved from day one, this goes well beyond what I visioned and thought of at the beginning. We thought it was going to be good. It's turned out to be great, and we're going to even bigger places. For those of you who are in the private sector and community supporters of U of A, keep up your support. We need this university to continue to keep up its national and international reputation, because that is nothing but a good thing for the future economy of our state. The success of our first-rate research universities and the future success of our economy are one in the same. So thank you for letting me say a few words. Congratulations, University of Arizona, those early investors in the biomedical campus. Great news about the economic impact. Thank you so very much.
Thank you, Mayor. I would now like to introduce my colleague who has both the pleasure and the task of overseeing the health sciences both in Tucson and Phoenix. one of the more complex jobs at a university, under President Hart, but above the rest of us, needless to say. I'd like to introduce Dr. Skip Garcia to say a few words. So welcome, Skip.
Well, thank you, Stuart. It's always great to follow the mayor here. So much energy I feel at the podium right now. This is really, truly an exciting announcement that we've all heard from Paul and his team. And I think it's really important for us to acknowledge just how instrumental the vision of Mayor Stanton was in the successes that were outlined today. And I also want to just point out, and I really mean this in a very heartfelt way, how critical to the success was the strong leadership of Dean Flynn here. So if you allow me, let's just join me in acknowledging these two individuals. Through Dean Flynn's leadership, the college has grown enormously in each of its important academic missions. And the college here is joined by an ever-increasing presence by our other health science colleges, pharmacy, nursing, and public health. And the scientists and the providers here are together creating new knowledge that would absolutely drive the way we take care of patients, drive healthcare, and improve healthcare for our folks in Arizona. And importantly, that environment of new knowledge creation is exactly the right kind of environment where you train the next generation of biomedical researchers and clinical providers in order to have the very best people of high quality for our state. Now, the sort of science the scope of the science that folks here and across our university are focused on include, of course, the very common but terribly complex diseases like lung and heart disease, like cancer, like diabetes. And these all fall within the scope that is our health sciences scope and part of the Never Settle plan that President Hart has for the university on how we grow our research portfolio. Health disparities, precision health, population health, and neurosciences are the areas that we will be growing on this campus in a targeted way, particularly with the advent of the 10-story partnership building that everyone has spoken to about, which is an enormous boost to this recruitment. We will be bringing into this campus the best and brightest academic leaders, funded leaders, bring to this campus the type of expertise and thought leadership that is so important for the growth of this campus and will help accelerate the development of this campus into the next great academic health center. And it's important to know that these recruitments have a tremendous impact on us. As some of you have heard me say before, every funded academician that we bring to this campus is like recruiting a small business. Not only is that individual a thought leader, bring national prestige to the campus, but they bring a laboratory of really talented folks that have jobs, pay taxes, and they bring federally funded dollars that help support their research. So it is truly an impact on our economy, but also an impact on the way that we will develop as a health science center. So let me just close by saying it's wonderful to see the impact of the university and of the Phoenix Biomedical Campus on this region and on our state. It's going to definitely affect our economy. It will absolutely affect the health of Arizona. So thank you so much.
Thank you, Skip. So I'd like to close by thanking each and every one of you for coming here. Thank Paul for all and Denise and their team for all of their very hard work and willingness to come here and present. And I'd like to thank the business community, legislators, and the community in general for everything that you've given us and allowed us to grow to this point. And we're comfortable. We're going to continue to make you very proud in what we're doing. On that note, I do want to extend again heartfelt. If you want to come down to this campus and just tour, walk around a little bit, just let us know. We'd love to host you. I hope you have a wonderful rest of your afternoon, and I wish you all a very nice holiday season. Thank you very much for coming.